Well, hello there. It's Dr. Brian McKay, not just a chiropractor for Stamford, Darien, Norwalk, and Canaan. Again, probably the worst title you can come up with for a podcast, but it's how people can pick it up easier. So there's a reason why I have that messed up name for my podcast. Hopefully, it doesn't annoy you. Anyhow, spinal decompression. Let's go into it. Started many years ago. I'm actually doing it now for about 23 years, give or take. What happened was I actually had a bad back myself, and a salesman came in. I was going out to lunch, and he had this great machine. Does wonders, and it was spinal decompression. Now, the thing was invented originally by a guy named Norman Shealy. Norman Shealy I'm not sure if he's even still alive. He's an older guy now, especially if I've been doing it for 22 plus years. Norman Shealy was a neurosurgeon, and what happened was sometimes he operated on one guy like 9 times. Just the guy would beg him, but at that point you're getting scar tissue on top of scar tissue on top of scar tissue. So it's really not a good scenario, but the person's just like desperate for any kind of relief. So he decided that if you could traction the back using long axis axial traction, what happens is you're going to get this cerebrospinal fluid, which is it bathes the spine. It brings nutrients, to the spinal column itself through osmosis. You try to create negative pressure within the disc space. So when a disc is herniated and is protruding into the intervertebral foramen, or the disc is protruding into the spinal canal itself, what do is this traction motion allows the fluid to come in and basically rehydrate a desiccated or dried out disc, a lumbar herniated disc in your back. So it's a really good treatment. And what I found was I used it on myself. I always call it my hair club for men story, is that I got better. It wasn't like I wasn't trying. I tried chiropractic, I tried PT, medication. You're getting kind of desperate there. And what happens is it worked wonders for me. But the salesman, I was trying to shoo him out the door. And this is really like a classic salesman. I'm trying to get him out the office. Said, no, I'm not interested in spending $150,000 on your new machine. And he put his foot in the door. Seriously, as I was trying to push him out. And he said to me, he goes, well, how about I leave it with you for a month or two? You try it out. And if you like it, you buy it. And said, you only have to cover the cost of insure. You have to insure it while it's in your presence. We'll ship it up, train your staff, and get on. So basically, I was thinking pretty self-centered attitude, but okay, let's go. I have nothing to lose. I've tried everything else. And what happened was everything started to come together. The exercise I was doing, the chiropractic started coming together, and it's not for everybody, but if you got a bulging or herniated disc in the back, I hate to say this, but a chiropractic adjustment alone is probably not enough to get that, call it the genie back in the bottle. And if you want to think of it in a different term, all you got to do is next time you're brushing your teeth, which hopefully is going to be twice a day, when you're done and you put it on the toothpaste onto your toothbrush, there's a little bit left that you still have pressure on the tube. And what happens is when you release the pressure on the tube, that the toothpaste comes back inside. That's creating negative pressure within the tube, allowing the reabsorption of the toothpaste. Same thing happens with spinal decompression. So spinal decompression has been a godsend for many, many people in that it frees up the low back. Very, very good. It's like So there's been a lot of changes with spinal decompression over the years. Initially it was just like I said, the long axis, and the long axis is okay. Again, just like the tube of toothpaste, when you see the fluid go back in. But for the long run, we're kind of thinking we're on fourth generation now, and the fourth generation has really, really good features in that there's lateral bending. So if the intervertebral foramen is blocked, what will happen is you can open that intervertebral foramen up specifically with a different pull. So there's angulation to the pull, and there's also different levels. So it can go like 10 degrees, 20 degrees, 30 degrees, depending on severity. And also, that's how you ramp up the treatment. So it's not like everybody's going to get the same treatment every time. You're going to take them through a gradient where they get more results, hopefully. So the spinal decompression is a great adjunct to the chiropractic treatment, because you have to put the bones back into place to take the pressure off. But then that disc is still an issue. And it's a fantastic treatment. It's really not that painful for the most part. It shouldn't be painful. The only thing is a caveat would be is if it was done too early. You know, people kind of want to just get right on the machine. It's not a good idea to put someone just right onto the machine because that's what they want, because it's always not the time to do it. You want to stabilize the spine and the pelvis before you jump into it. So, like I said, we've been doing it now for, gosh, 22, 23 years, and it's a phenomenal treatment. And if you have chronic low back pain, just doing physical therapy alone, probably not going to nail it. It's great to exercise, and you should always exercise. But sometimes what I do now is I'll put people through the program and then send them physical therapy to have that area strengthened. I mean, some patients really don't follow through with exercise like they should. So it's one of those things that I'm using it. I use it every day. I've got 3 machines going. I use it for cervical as well as low back, but it's a phenomenal way to get the genie back in the bottle, get that disc back where it belongs, and basically get you out of pain. The problem, though, does come in is that, it's not cheap. Okay, it's kind of like I don't overcharge for it. I use it. I use it generously, and I don't. I mean, some people charge like $7,000 for 20 sessions, and listen. If you get out of back pain, great. I think it's a little bit high to do that. It's a big number, so I price it a lot less. I'd rather have more people get the treatment. It's not that I run a discount chiropractic office. It's just that I feel it's a little bit better. Um, you know, make it more. I mean, I have 3 machines, so it's not like I run out of it. Um, and basically you're looking at a 71 to 89% of the patients have success with it. There's been more than 10 different research, studies been conducted, with all of them showing good results for patients treated with spinal decompression. So it's a good thing to do. And again, but then afterwards, you really should do physical therapy as well, or make sure you're exercising really, really hard and working it so you stay, you keep your body in good shape, because, there's less chance of you having a reoccurrence. So spinal decompression, sometimes people ask, does it cause damage? No, it really can't, except if there's bleeding. You know what I'm saying? What you do is you start out at a low gradient and you work your way up. So it's really very little damage you can do. Now, the other question is Medicare covered? No, Medicare insurance does not cover it. It takes many years before an insurance company is going to say, okay, we like this treatment and we're gonna spend we're gonna pay for it. So that's why it's kind of expensive, and the equipment cost can contribute to why it's going to cost, some places, $6,000-7,000 to do it. Um, it's expensive, but listen, if it's going to work, if you've got a 70% or better chance of getting results, it may be something for you to try. But I really recommend you trying it with solid chiropractic work as well, to remove the bone, fix the structure. Because if your structure is altered, it's not going to function properly. And that's the thing is, and basically it's about 20 to 24 sessions is how long you need it. Now, people talk about the inversion tables, which you can get online for a couple $100. That's gravity and long axis, but it's really not the same. I mean, it's not going to hurt. Believe me, it's not going to hurt. If anything, it's good to get some blood flow to your brain, um, but it's just not the same. It really isn't. So there's many different types of machines out there, but also almost basically do the same thing. It's just that the latest generation, it's a machine's called the back on track, and that's where you have the lateral bending and much more flexibility uh, in going through a progression with somebody's case. So I'm Dr. Brian McKay, not just a chiropractor. Stanford Darien Norwood New Canaan, yes, the long name. If you got questions on decompression, I'm more than happy to answer it and make a referral. Because listen, I practice in Darien, Connecticut, and we basically serve Stanford, Darien, Norwalk, and New Canaan. I'm in the middle of those, but it's kind of if you have a question, give me a call. The number is 203-656-3636. 203-656-3636. All right. Thank you very much. And keep listening. Hopefully you enjoy this talk. All right. Have a great day, and have a nice Christmas. We're about a week away from Christmas. Today is December 17th. All right. Thanks very much. Have a good one.